Welcome to the Home Health Care Today show. It is National Kidney Month. I am your host, Dr. Cleamon Moorer. Today, we have the distinguished pleasure of having an expert as well as a living kidney donor on our show to share not only their experiences and their expertise, but insight for the listening and viewing audience. Dr. Silas P. Norman, MD and Master of Public Health, is a transplant nephrologist, Associate Transplant Center Director at the University of Michigan Health, Chair of the Minority Organ Tissue Transplant Education Program of Detroit, and he's also a Detroit native. Melinda Ann O'Neill is an IT Executive Director of Strategic Accounts at Island. She is a living kidney donor, a mentor, 2024 ACW INSPIRE Award winner. Dr. Norman and Melinda Ann O'Neill, welcome to our show.
Thank you.
Thank you.
All right, so let's just dive right into the crises as well as the calling as related to kidneys and kidney health. Dr. Norman, welcome back to the show. And Melinda Ann, welcome to the show for the first time, right?
Thank you.
Now let's set the stage. 35.5 million Americans have kidney disease, but 9 out of 10 don't even know that they have it. Dr. Norman, why is kidney disease so silent?
That's a great question. The main problem with kidney disease is that many people don't have any symptoms until you have very advanced stages of kidney disease. And so often people don't come into care until they start feeling poorly, short of breath, feeling really run down and tired. And by then they typically have advanced disease.
Okay, I gotcha. So let's dive a little deeper that. Growing up in the Detroit area, you became one of the nation's leading transplant nephrologists. Before med school, you worked as a foster care worker. Okay, now, how did that experience, Doc, shape the work that you do now?
Well, it's certainly having the opportunity to help care for some of those kids certainly made me see that here are some young people who deserve to grow up healthy. At the same time, recognizing a lot of resource difficulties. These kids had limited means, limited access to health care. And so you could see how with that limited access to health care, people may develop diseases like kidney disease.
Absolutely. Okay, got it. Okay, so some of the whole social determinants of health and some of the challenges there. Speaking of which, Melinda Ann, we know that there's a digital divide. You work on a daily basis to close digital divides as an IT executive, not a healthcare executive per se.
Mm-hmm.
What pushed you or made you think about being a kidney donor?
Another great question. And I think much like others,
Yes.
you don't think about it. It's there's a situation that's presented to you and it becomes an opportunity or a challenge. And that's what happened with me. My dad passed away suddenly,
Yes.
very unexpectedly at the age of 58. And a couple of weeks after that, at his funeral, somebody didn't make it to his funeral that we expected to be there. When we questioned why that person wasn't there, we were told, well, she's sick. Her sickness was that she was on dialysis. She was on a transplant list, and she'd been on a list for about 2 years at that point. A 30-year-old adult with 2 kids, a wife, just dying. She was 86 pounds. So when I got the call, my mom and sister went to go visit her to figure out what was wrong. My sister said, she's on a transplant list and she's O positive. At that moment, you don't really think about, do I want to be a kidney donor?
Right.
I knew I was O positive.
Yes.
Immediately, I called my doctor and said, how do I become a kidney donor?
Okay.
Yeah, so it's not something that, I really had a chance to think about.
Okay.
In my head, my dad passed away unexpectedly. And in that moment, I knew he was taken from us so that we could find out about her.
Melinda, thank you, for sharing, that piece of the story, and condolences, on the loss of your father. but also congratulations on finding purpose, right? And an opportunity to assist someone else.
Thank you.
Okay, so this episode is, integrative because not only do we have a donor, listeners and viewers, we have a kidney transplant specialist and a nephrologist, and Dr. Norman here. So, Melinda Ann, when you make up your mind to call a doctor, right? Like Dr. Norman here, what's the process from, okay, I am type O, I'm going to do this. Walk us through that journey.
Absolutely. And it's funny because Dr. Norman and I were talking before this,
Yes.
before we went on air here, and things have changed so much even from the time that I, donated my kidney until today, because medicine changes so quickly and so slowly at the same time. But my process was interesting in that, I called it was the University of Michigan Transplant Center.
Yes.
I donated my kidney at the University of Virginia, Charlottesville, because that's where she lived.
Wow.
In Virginia. So my testing was done here in Ann Arbor. Blood tests, literally FedEx boxes dropped off. But I went through physical tests, mental tests. They wanted to make sure that I understood what I was getting into. And it took about 6 months. So once they cleared me and she was healthy enough to withstand the surgery, because she was very, very sick, I went to Virginia. I remember the night before drinking all the liquids, just getting ready for the surgery. I stayed with her for about a week before we had surgery. So we stayed in the same house, and the surgery was about 7 hours long. I think one of the things that stands out, though, is there are 3 surgeries a day. They did them on Thursdays. It was March 26th, so upcoming kidneyversary.
Oh, yes.
They said, come in early, 2 to 3 hours, I think it was, early before our surgery was booked. So we were the second surgery of the day. Shortly after, I'm talking 15, 20 minutes after we got there, we were called back because the first surgery failed for whatever reason, and they took us early. So that was one of those moments where I thought something could go wrong. Definitely. You just have no idea. I really wasn't worried up until that moment. Surgery was beautiful. I donated my right kidney because, this left was connected with 2 arteries. It was less invasive to take the right. I guess normally they take the left, correct? So upon healing, she immediately came home. She was phenomenal. She was in her garden. This is somebody who was literally on dialysis almost the entire day. Wow. And I had to stay in the hospital. Yes. I got pneumonia. I wasn't moving enough. I wasn't healing properly. I lost feeling in my legs. It was so interesting. I would do it again. I just say that because everybody heals differently. Absolutely. That was my experience, but it changed my life for better.
Wow. Thank you. Okay. All right. Dr. Norman, so you consult patients all the time, right? There's a higher percentage of ethnic minorities that suffer from kidney disease. What drives that? What's going on?
So 2/3 of the causes of kidney disease are diabetes and high blood pressure.
Yes, sir.
Both diabetes and high blood pressure are more prevalent in African Americans and some other ethnicities. And as a result, we see more kidney disease. And then compounding that, we see more progression because of the socioeconomic things we talked about, this lack of care, among other things. So you see more progression.
Okay, so if we're able to do a better job of perhaps managing diabetes for the listening and viewers out there, as well as high blood pressure, does that decrease or diminish the risk of chronic kidney disease?
It does. It does. It can dramatically. And so we really can prevent a lot of kidney disease and slow progression with management of diabetes and high blood pressure.
That's hopeful. That's hopeful. Doc, you've provided hope in a number of ways. So let's go back to the program that you pioneered at University of Michigan to transplant HIV positive patients when most people said it couldn't be done. Take us back to 2005 and that first transplant. What was that moment like?
So it was terrific. So like many advances in medicine, it takes a team, right? So we had a team. I had a great partner, Dr. Dan Call, who's one of our infectious disease folks. And at the time, there was a surgeon in San Francisco who was doing a lot of this pioneering work, showing really that with the way we were delivering medical care and transplant, we really could safely transplant individuals who had HIV and have them have great outcomes. So we were able to work this through with our team. We got some folks on the list. We transplanted our first patient, I believe, in April of 2006. 5,
Yes. Wow.
and who did great from a kidney standpoint.
Oh, wow. Okay. So lots of hope out there for sure. All right. We got a few minutes before we get to our first commercial. Melinda Ann, as well as Dr. Norman, what are the one thing, or is the one thing that you want people to know about, of course, being a kidney donor from the perspective of a donor, and then Doc from the perspective of a nephrologist? What should people know about kidney donations?
You know, I would, for me, I would say there are no limits.
Okay.
I get a lot of calls and field a lot of questions like, can I still do this? Can I ride a motorcycle? Can I walk? Like just
Yes.
interesting questions where if you don't know, you don't know, right? You're really not limited, right? I'm not, I can't do the ibuprofens anymore, right? I can steer clear of Motrin, but it's made me better. I'm healthier. I focus more on my health and taking care of the rest of my body because I know I'm without an organ here. I'm down an organ. So I'm focused on making myself better. So limitations are, you're not limited.
Okay. Doc?
You know, and what I would say is, you know, transplant is what I do day to day, but prevention is the key. And so the first step of that is people really need to know their kidney numbers. They need to know the measurement of their kidney function. They need to know whether they have protein in their urine. Those are cheap, easy tests to get, and so it behooves all of us to have that information so that we can, you know, be in the best position to advocate for our health.
This is wonderful, wonderful. Melinda Ann, you were in the hospital, so this is, you know, one more bonus question here.
Great.
You were in the hospital longer than the recipient. All right, let's fast forward. Are you still in touch with the recipient, right? And how is she doing? How's her life progressing?
She's phenomenal. I just saw her last year. Unfortunately, her brother passed away suddenly, unexpectedly, and you know they're younger than I am. I will tell you one of the most amazing things. Her kids, I haven't seen her kids since they were little. One was 17 months old when I was there. They came up to me. I didn't know who they were, and they were thanking me, and they're like, I'm not wearing waterproof mascara. I was not set up for this, but they were so thankful that I was there, and they were like, "You're the one who gave us our mom." And I don't think you know how it affects people because I can see you. I know I gave you my kidney, but when you see the others that it's impacted, that's where you're like, oh my gosh, I did that.
Absolutely.
So it's wonderful. She's phenomenal.
Wonderful.
Yeah. And the kidney is still working beautifully.
Wonderful. Absolutely. Well, hey, folks, once again, it is National Kidney Month. We're headed to a commercial. On the other side of the commercial, we're going to dive deeper, right? So stay tuned. We'll be right back. Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today. We went from podcast to broadcast. The Home Healthcare Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned. Welcome back to the Home Healthcare Today show. The topic is still National Kidney Month. And last week, our clock sprung forward 1 hour, right? So our Meridian moment is tied to not only time management, but hey, chores, assistance, support at home. So for the caregivers out there, for the homebound, for individuals that need additional help at home, feel free to visit my for Michigan, mimeridian.com. And we're American Advantage Home Care, so we could easily come in and provide those support services for anyone out there in our listening and viewer audience. But back to Healthy Kidneys and Kidney Month here, National Kidney Month. Dr. Norman, when a patient walks in, like Melinda Ann, for example, that says, I want to be a kidney donor, right? What does that moment feel like for you? What happens at that point?
Yeah, no, it's terrific. We have in Michigan, there's some 2,300 people on the waiting list waiting for kidneys right now. For people on the deceased donor waiting list, that waiting time can be around 5.5 years sometimes, so it can be very hard on people. And we know that a living donor kidney transplant is the best way for transplant to happen. it happens in a more timely manner. People tend to be healthier, and those kidneys tend to last longer. So it's great when people come forward and volunteer, and then we just, as Melinda talked about, we do the evaluation to make sure that people are healthy enough to move forward, so that after their donation, they remain healthy and they help somebody.
Wonderful, Doc. Are there some ways that folks can sign up? I know every time I go to DMV to renew my driver's license, I'm asked, "Hey, want to be a organ donor?" And I specify yes, organ donor. But for others, what are the ways that we can get more people?
Yeah, so absolutely. So we certainly encourage everybody
Yes.
to consider registering as an organ donor.
Yes, sir.
You can do that, as you said, at the Secretary of State's office. So when you're there, you can go online to giftoflifemichigan.org and register.
Yes, sir.
There are connections to the University of Michigan's website as well. And the important thing is just to sign up. It doesn't change any of your medical care.
Yes.
One of the important things for people to know as they register to be organ donors is talk to your family. Make sure
Yes.
that they're aware of your wishes, so that at the time of your passing, they can honor those wishes for you to be an organ donor.
Absolutely. Thank you, Dr. Norman. Thank you. Going back to that waiting list, though, so we want to encourage folks to take those steps that would like to or designate themselves as a organ donor. But going back to the 90,000 Americans that are on that wait list, 13 people die every day waiting. Melinda, you help make sure that someone did not become one of those 13 individuals. How does that sit with you?
It's
Yeah.
it is interesting. I shared earlier just meeting or seeing the kids
Yes.
of the person I donated a kidney
Yeah.
to, and seeing how it impacted them. And that's something you just really don't think about day to day.
Yeah.
When somebody sees that you're an organ donor or learns that you're an organ donor, usually there's shock.
Uh-huh.
And then you're like, I guess not everybody does that.
Right.
Not everybody's like, take a piece of me and put it in you and let it work.
True.
But not everybody's presented with that opportunity. So I would say, it's an interesting feeling just knowing. And when I was sitting with Dr. Norman earlier, I said, I saved one person, but you saved hundreds of lives. Like
Yeah.
you do this like it's a Thursday and you're just like, 5 lives to save today, So for me, it's humbling to even be sitting
Yeah.
next to a nephrologist, somebody
Yes.
who can literally give you life.
Yep.
Just the thought of being able to help people, but seeing how it affects others, that it sits with you in a weird way.
Yeah.
Because once the moment's over and then you revisit it, you're like, I guess I did do that.
Yes, you did.
I did do that.
Yep. So it's weirdly wonderful, right? Yep. Yep. And we're able to showcase these types of miracles on the Home Healthcare Today show for sure. Now let's go back though, because I want to dive deeper into prevention because as our home health care company, we go out and we take care of a lot of people. And even through our eye care organization, Eye Care for Michigan, we do a lot of diabetic eye exams, Dr. Norman. So for folks watching today that want to get a better grip on high blood pressure, as well as diabetes management, what can they do today to protect their kidneys? And then what tests should they ask for? Because like I said, we're able to do diabetic eye exams and see what's going on with folks and make referrals. But what else can a person do in terms of testing?
Absolutely. So similar to kidney disease, where many people don't know they have it, some 120 million people in the country have high blood pressure.
Yes.
Perhaps 40% of people are not aware. And so by definition, they're not getting treated. And of the people who know they have high blood pressure, only about half of those folks are on medication, and only about 20% of people are controlled. So
Yes.
there's a lot of opportunity to reduce disease. Similarly, in diabetes, some 40 million people in the country with diabetes. Um, um, some people are unaware. Some people think because they haven't had dramatic organ outcomes, they're doing okay. So again, to prevent, first you got to know your numbers. You got to know your kidney numbers. Do you have protein in the urine? What your kidney measurement is? You've got to know if you have diabetes and are you controlled? And if not controlled, don't accept not being controlled. And if you have
Yes.
high blood pressure, you got to know,
You got to know.
and then you've got to get it controlled.
Absolutely, Doc. I'll use myself as a case study. Right. My primary care physician is right down the hall, Dr. Father Rahman Ali, and I stop by every now and then. And my last blood pressure, reading was like 130/90. It's like, Doc, you're a little elevated. Lose some weight. Work out at least an hour a day, and I'm going to check you again. Better yet, you start checking yourself once a week, right? So I definitely use myself as an example to suggest to our listeners and viewers that self-advocacy is oftentimes underrated, but it certainly starts with us trying to make better decisions as individuals, for sure. So let's keep going. We're having a good time here. Melinda, for someone watching who's thinking, I've considered being a donor. I got my blood pressure under control, right? I'm not a diabetic, but I'm a little scared. What would you say to those folks?
Valid, right?
Yep.
Understandable. And I actually get calls quite a bit from just random people who, I got a call recently. It was somebody who was looking to donate to their brother, and they asked, will I be able to ride my motorcycle still? Just, questions like that. So again, you're not limited, but you should know, right? Everybody heals differently, right? True. When I was going through classes and at the University of Michigan, and they just wanted us to know everything, right? There was a gentleman in there, and he's like, my name's Joe, and I'm a contractor, and I was back to work in a week. I was younger then, right? I was like, I'm Joe, I'm healthier than Joe.
Right.
It took me 4 months to get back to work. So we all heal differently and understand that. But as long as you have a support group around you, and earlier when you said, make sure your family knows, right? When it was presented to me, that wasn't planned, right? That was just hey, she's on a transplant list, she's O positive. Yes. She wasn't asking me to donate. She just wanted me to know, and that's when I was like, I'm donating.
Yes.
My family and a lot of my friends were like, why would you do that? You have 4 kids. You're young. Why would you do that? And a lot of people just weren't on my side or happy. In my head, I wasn't doing, it made complete sense to me. That's why my dad was taken, so we would know about her.
Absolutely.
That's all I needed was to, be sent that message. But I would say you're not limited, but just know that everybody heals differently. Yes. Your life will change, but it will change for the better. Okay. I became an advocate for the Gift of Life Michigan. I'm on the United Network for Organ Sharing 2010 Annual Report. I'm the state of Michigan rep, and I worked with the National Kidney Foundation. So I think other than touching her life, I've been able to help others.
Absolutely. Very good, Melinda. And you're also on the board of I Care for Michigan, right? I am
on the board for I Care for Michigan and I Care for Detroit.
Busy enough. This is good. Thank you, Melinda. Going back to preparation and wellness, Dr. Norman, since we have a little more time left in the episode, the readiness from a mental standpoint, right? What are some prerequisites for mental health and mental health wellness as related to, going through a transplant?
So it's important both for the donor and the recipient. So for the person who needs a transplant, it can be a tremendous gift, but as you said, you've got to be ready. Yes. You need to have a good support system around you. There's going to be a lot of visits, a lot of blood draws, a lot of medication. So you really have to be in the right place that you're ready for that journey. You need to be your best health advocate. Make sure that when you get to the doctor, you're asking us all the questions and getting all the information that you need. And then as Melinda said, on the donor end, also make sure that the donors have, that we've met their expectations going into the process, that they understand what their recovery might be like, so that everyone comes out on the other side of this satisfied with a good outcome.
This is good, Doc. Thank you for that. Dr. Norman, going back to your work and the foundation work, Detroit MOTTEP Foundation, you served on multiple committees. What policy changes do we need to move the needle on this crisis? So now we're going back to public or larger public health domain from a policy standpoint. What needs to change?
So there's 2 or 3 things. On the living donor end, there's legislation that's worked its way through Michigan and needs to get through other states to support living kidney donors in terms of donor health protections for them in the future, and also just making it financially at least cost neutral for people who are interested in doing it, being able to do it. taking the time off work, and so forth. And for our recipients, making sure people have the appropriate insurance coverage, not just for transplant, but that insurance continues lifelong, because both we and they have made, and the donors or donor families have made a large investment in this transplant. We want it to work as long as possible. And so making sure people have what they need to afford their medications, afford their care lifelong is critical.
Absolutely. Very good. And then, of course, I guess like the education and support for continued wellness, lifestyle changes, habits, and the like. So, oh man. Okay. This is one of my favorite episodes to date. It truly is. So we got to wrap it up and wind down to our last question here. Final question for both of you. All right. One message that you want viewers, as well as listeners of the podcast, viewers of the television show, to take away from this conversation. Starting with you, Melinda.
You can make a difference. Like, sometimes you just feel like you're in a sea of billions of people, and you are. There are billions of people in the world. You can be the one person to make a change.
Yes.
So
one person,
be that change.
Ripple effect. Very good. Thank you, Doc.
I had to go back to know your kidney numbers and register to be an organ donor.
Very good. Wonderful. Hey, all right, everyone. I hope those, not only the last couple of tidbits of advice stick, but all of the merits, right? All of the merits and key points in this National Kidney Month episode, stick with the families, as well as, supporters or friends of individuals out there that are considering becoming a kidney donor. And then for those that are saying, I want to live a healthier lifestyle, right, to prevent myself from having chronic kidney disease. That does it for this episode of the Home Healthcare Today show. Tune in next Saturday morning at 10 a.m. We're going to focus on World Oral Health Day. We're going to look at the connections between healthy teeth and gums and overall health outcomes. We'll see you next week. Every Saturday at 10 a.m., we bring the Home Healthcare Today show, hosted by Dr. Cleamon Moorer and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10.
That there are oral bacteria contained in those lesions.
Yes.
And so they're really making the connection between what type of bacteria it is, what process in the mouth is responsible for that bacteria, and more importantly, how do we get rid of it?
Yes.
So that way, you may be doing all of the things that your doctor recommends, but if you still have that gum disease, you still have the decay in your mouth, it is feeding that bacteria into the heart or to other body systems like the respiratory system.
Yes.